Hi, this is Randy Wykoff, the Dean of Public Health at East Tennessee State University, and this is your bare bones approach to better health. The closing of rural hospitals is not a new problem, but it appears to have become much worse recently. Since 2010, 167 rural hospitals have closed or stopped having inpatient services, and over 400 are vulnerable to closing. When a rural hospital closes, the community loses more than just healthcare. It can lose between 200 and 300 jobs. This is something of a perfect storm because rural hospitals typically serve older citizens, people with lower incomes, and often patients with long-standing chronic diseases. The majority of these hospitals are not closing because of mismanagement or any other factor that their leadership can control. They're closing primarily because our reimbursement system doesn't pay them as much as they need to operate. Last year, about half of all rural hospitals were operating in the red. This problem is especially pronounced in those states that have not expanded Medicaid and in states with large numbers of people on Medicare Advantage plans. We need changes in how rural hospitals are reimbursed and in some of the regulatory requirements that will allow them to stay in business. For more information on rural hospital closures compiled by Ms. Leah Loveday, please go to wets.org/barebones. And until next week, please be well.